Hello, this is Akram Jafar, and in this session I'm going to deal with the cross-sectional and imaging anatomy of the female pelvis. The anatomical sections are arranged to match axial CT and MRI sections, so this will be the right side and here is the left side. I will start at the level of the iliac crest and descend until the perineum. Some key axial CT sections are provided in between for comparison. In this section, let's start from the midline anteriorly. Just underneath the skin is the adipose tissue, the subcutaneous fat, and you can see that this yellowish material is also present inside the abdomen, the visceral fat. Here is the abdominal wall, and in the midline is the linea alba. On either side of the linea alba is the rectus abdominis muscle. If we go more laterally, we can see the aponeuroses of the muscles of the anterolateral abdominal wall. More laterally, these are the three muscles: the transverse abdominis, and then the internal oblique, and then the external oblique. If we go more posteriorly, we'll find the beginning of the iliac crest, and so we are at the top of the hip bone. This is the supracristal plane, and we are in fact at the level of the lower border of L4 vertebra. Look at the body of the vertebra, and this is the vertebral arch, and you can see that inside there is no spinal cord in the vertebral canal, only the coda equina, because the spinal cord has ended at a higher level at the lower border of L1. You can see here the zygapophyseal joint, and this is the spinous process of the vertebra. Posterior to the vertebra, we can see muscle fibers, and these belong to the erector spinae group of muscles. On the lateral side of the body of the vertebra, you can see the psoas major muscle, and this is located behind the peritoneum. Behind the peritoneum, you can also see that there is a retroperitoneal fat or extraperitoneal tissue, and this is part of the visceral fat. There is a lot of adipose tissue in between the loops of the small intestine. These are the loops of the ileum, because we are in the lower part of the abdomen. On the right side, you can see part of the large intestine, and this is the cecum. On the left side, this should be part of the descending colon. More anteriorly, the adipose tissue is present in the greater omentum, which is the apron-like fold of peritoneum that hangs down from the transverse colon and is located anterior to the loops of the small intestine. Posterior to the loops of the ileum, the adipose tissue is present in the mesentery of the small intestine, and in which you can also see that there are a lot of blood vessels. These are the blood vessels that are going to form the arcades that supply the small intestine and reach the small intestine through the mesentery. Behind the mesentery is the retroperitoneum, and in front of the vertebral body you can see blood vessels. Here at this level, the lower border of L4, the aorta has just divided into two common iliac arteries, but this is just at the beginning, so the two terminal branches have not separated much from each other. You can compare the shape of the artery and the thickness of its wall with that of the accompanying vein. This should be the inferior vena cava at its beginning. The inferior vena cava is formed at a lower level than the bifurcation of the aorta, and so at the level when the aorta has already divided, the inferior vena cava is starting to form. So as we are looking at the vessels in front of the vertebral body, let's follow them down to the next section. In this section, you can see the two common iliac vessels. They are separated from each other, and also you can see the right common iliac vein, which looks more vertical in section than the left common iliac vein. And the reason is that the left common iliac vein has to cross the midline to the right side and join the right common iliac vein to form the inferior vena cava, which is located to the right of the midline. More laterally in the pelvic wall, I can see the wing of the ilium, or the ala of the ilium. The iliac fossa is located on the internal surface. Within the iliac fossa, the muscle fibers belong to the iliacus muscle. On the external surface, or the gluteal surface of the ilium, is the gluteus medius muscle. It has a higher position than the gluteus maximus, so we cannot find them both together at this level. We have to go down to see them both, gluteus maximus and gluteus medius. If you look at the vertebra, you can see the transverse process of the vertebra, the vertebral arch, the zygapophyseal joint, and this should be the intervertebral disc between L5 and S1. No much differences in other structures. In this CT, you can see the linea alba, rectus abdominis, the external oblique, internal oblique, transversus abdominis. Here's the ala of the ilium. Externally is the gluteus medius, internally is the iliacus muscle. More posteriorly, this is the erector spinae, and this is a lumbar vertebra, the vertebral arch, zygapophyseal joint, spinous process, transverse process here. Between the body and the transverse process is the psoas major muscle on either side. These are intestinal loops. This should be the cecum on the right side and descending colon on the left side. And in the front of the vertebral body, I can see here the artery, the common iliac arteries, and these are the common iliac veins. So definitely we are at the lower border of L5 vertebra, where the inferior vena cava has not formed yet and the aorta has already bifurcated. Now let's look at some of the changes that took place at a lower level. In the wall, the ilium is thicker. You can still see gluteus medius muscle, but also you can see the beginning of the gluteus maximus muscle. Gluteus maximus is going to cover the gluteus medius. And here I can see the sacrum. Look at the ala of the sacrum here. And the beginning of the formation of the sacroiliac joint. And the whitish area here indicates the presence of the thick and strong interosseous sacroiliac ligaments. If we look at the structures that are located in the front of the sacrum, we can see blood vessels. Now the common iliac vessels, at least the artery, has divided into external and internal iliac artery, external and internal. And these are the veins, common iliac veins. Again, as I said, that the vein has a thinner wall than the artery, and that's why the shape of the artery in section is more uniform than the vein. In addition, the size of the vein is usually a little bigger than the size of the accompanying artery. If I look at the region of the cecum, I can see here that there's a trace of the appendix, no changes in the other features. Let's go down to a lower section. In the anterolateral abdominal wall, the muscles have now faded, little flesh is only left, and posteriorly we can see the three gluteal muscles by now, gluteus maximus, gluteus medius, and the gluteus minimus muscle. Look at the sacrum now. It is showing clearly the sacroiliac joint, and you can see that it is a plain joint, although there are some undulating surfaces. Also, there are traces of the whitish articular cartilage. Anterior to the sacrum, there are few muscle fibers appearing, and this is the beginning of the piriformis muscle. More laterally, and in the iliac fossa, is the iliacus muscle, and the psoas major is becoming more slender at this location, and it's, as we know, that it's gradually is going to fuse with the tendon of the iliacus and form the iliopsoas tendon that's going to be attached to the lesser trochanter of the femur. Look at the blood vessels on either side. There are more blood vessels because both the arteries and veins have already split into external and internal iliac vessels. So these sections belong to the internal iliac vessels, supply the structures that are present in the pelvis, perineum, and the gluteal region. The external iliac vessels, they don't have branches, as you can see here, until they reach close to the inguinal ligament and then continue as the femoral artery. In this CT, in the midline anteriorly is the linea alba, then the rectus abdominis, the fading muscle fibers of the anterolateral abdominal wall muscles, and this will be the anterior superior iliac spine. On the outer surface of the ilium is the gluteal region. You can see gluteus maximus, gluteus medius, and gluteus minimus. Posteriorly is the sacrum, and these are the ala of the sacrum laterally. This is the sacroiliac joint. And inside, in the region of the iliac fossa, here's the iliacus, the psoas major. Here again, psoas major and iliacus. And these are some intestinal loops. And you can see evidence of blood vessels here. External and internal iliac blood vessels. As we will go down in this section, look posteriorly in the front of the lateral part of the sacrum is showing piriformis muscle. Now it is well formed. It looks piriform in shape, and hence the name of the muscle. It's going to leave the pelvis, as we will see in the next section, through the greater sciatic notch. You can see here on this side that there is some deficiency and that there are some blood vessels leaving the pelvis. These are branches of the internal iliac vessels, while the external iliac vessels are located more anteriorly, here and here on the left side. These are external iliac vessels. They are heading anteriorly, and they are much away from the internal iliac vessels than what we have seen previously. In between the external and internal iliac vessels, this region here on the lateral wall of the pelvis is called the ovarian fossa. I can see here that there is probably, this is an evidence of an ovary on this side between external and internal iliac vessels close to the wall of the pelvis. Also on the right side, this should be the ovary. It cannot be clearly differentiated from the surrounding fatty tissue. In this section at a lower level, if we look posteriorly, we can see in the midline that there is only a narrow part of bone. This is the tapered end of the sacrum. On the lateral side, the bone is becoming narrow, and this is the part of bone that's going to fuse with the ischium at a lower level. Also, you can see the piriformis muscle has now left the pelvis to the gluteal region, here and here, accompanied by blood vessels and nerves. In front of the sacrum, in the midline, is the rectum, and in front of it, I can see a loop of intestine. This is the large intestine, and you can see that there are many diverticula in this loop. This is an evidence of diverticular disease that mainly affects the sigmoid colon. Also, I can still see parts of the ilium here, and more anteriorly is the greater omentum. On the side of the pelvis, a newly appearing muscle here and here. This is the beginning of obturator internus muscle. And again, you can see that the external iliac vessels are heading more anteriorly. This should be the iliacus and psoas major muscle. In this section at a lower level, if I look posteriorly, I can still see some of the sacrum, tip of the sacrum, beginning of the coccyx. In front is the rectum, and in front is the loop of the sigmoid colon, loops of small intestine. In between them, this is something new. It wasn't present in the previous section, and if I follow it down, you can still see it here and here. It will show that this is part of the uterus. In fact, this is the fundus of the uterus. In the CT, posteriorly, I can see the sacrum, the piriformis muscle. This is the uterus, and these are the external iliac vessels on either side, iliacus and psoas major muscle. And these should be branches of the internal iliac vessels. Now at this level, if I look laterally, I can see the beginning of the acetabulum. Look at the cartilage that lines the acetabulum, and also I can see here a glimpse of the rounded head of the femur. Posteriorly is the coccyx, in front of it is the rectum. In front is part of the sigmoid colon and small intestine here, and this is the uterus. So between the uterus and the rectum is the rectouterine pouch of Douglas, and you can see that it contains loops of small intestine and part of the sigmoid colon, because the sigmoid colon has a mesentery. If I look closely to the uterus, this will be at a level that is below the fundus of the uterus, between the fundus and the body of the uterus. So this is laterally is the region of the cornu, and extending from the cornu anteriorly on either side, this tissue is the round ligament of the uterus. You can see it is heading anteriorly, so that it is going to leave the abdomen at the deep inguinal ring to pass through the inguinal canal and reach the labium majus. In this CT, I can see here the tapered end of the sacrum. Here is the rectum. Anteriorly is the uterus, and you can see the round ligament of the uterus from either side. In this section, we can see the rectum posteriorly, the rectouterine pouch of Douglas containing loops of small intestine here, and more anteriorly is the uterus. Now the uterus is clearly showing a uterine cavity that is flattened anteroposteriorly. So this is the body of the uterus. And more laterally, you can see the sockets of the acetabulum. At a lower level, again, we can see the rectum, pouch of Douglas, the uterus anteriorly. The uterus is a little bit narrowed here, and this is the region of the isthmus of the uterus. That is the junction between the body of the uterus and the cervix, the lower part of the body of the uterus. And these lateral extensions represent the base of the broad ligament, in which the uterine arteries approach the uterus from the lateral wall of the pelvis. And these arteries, uterine arteries, are branches of the internal iliac artery. These are the branches of the internal iliac, and these are the external iliac vessels. Behind the uterus, this is the rectum, and you can see here one of the rectal valves of Houston. At a lower level, the rectum is a little bit bigger. It's now forming the ampulla of the rectum, the distended lower part of the rectum. More anteriorly is the cervix, and this is the cervical canal, and more anteriorly the roof of the urinary bladder. Laterally in the bone, it is clearly showing the ischial spine, and we can see some of the muscle fibers extending from the coccyx to the ischial spine. This is the coccyx, and here's the ischial spine, and these muscle fibers represent the coccygeus muscle, part of the levator ani muscle. They lie on the sacrospinous ligament, one of the two ligaments that convert the greater and lesser sciatic notches into foramina. In the gluteal region, we can see the gluteus maximus muscle, and here's the gluteus medius and gluteus minimus getting attached to the greater trochanter of the femur. Here's the head of the femur, the acetabulum, and I can see here the ligament of the head of the femur on this side as well, ligamentum teres, the round ligament of the head of the femur. At a lower level and posteriorly in the midline is the ampulla of the rectum. Anterior to it is the cervix entering into the vagina. So this will be the region of the vault of the vagina. More anteriorly, we can clearly see the urinary bladder. In this section, the three visceral structures in the midline are the urinary bladder anteriorly, and behind it is the vagina. Still, you can see some of the cervix here, but you can see that within the vagina and outside the cervix is the region of the fornix. These are the lateral fornices of the vagina. And just outside and the lateral fornix, this will be a stump of the ureter. And this one on the other side here. Look at the ureter, it is heading toward the urinary bladder. The ureter comes from the posterior wall of the pelvis and heads anteriorly, and it is located at a lower position than the uterine artery that crosses from the lateral wall to the medial wall, and we have seen it in a previous section in the base of the broad ligament. If we look at the bones, we can see here that there is a new bony feature. This is the beginning of the superior ramus of the pubis. So the muscle in the front of it is the pectineus muscle. It's forming part of the floor of the femoral triangle here. Look at the contents of the femoral triangle. The femoral vein medially, then the femoral artery, and this should be the region of the femoral nerve. The femoral nerve is not clearly showing because there's a lot of fat in the myelin, so we cannot clearly differentiate it from the surrounding subcutaneous fat. The lateral wall here is showing the obturator internus muscle. You can see some of the fibers of the obturator internus are bending below the level of the ischial spine and leaving the pelvis through the lesser sciatic notch. This should be the continuation of the tendon going to the greater trochanter, the base of the greater trochanter of the femur. Attached to the medial aspect of the obturator internus, actually the obturator fascia here, these few muscle fibers that represent the levator ani muscle, the thin pelvic diaphragm. This is a section at a lower level. If I follow the viscera, I can see the urinary bladder. Look at the ureter here, coming from back to the front. This is the ureter. This is the intramural portion of the ureter, one of the places where the ureter becomes narrowed and cause impaction of stone, ureteric stone. Posterior to that is the vagina, and again you can see there's a small piece of the cervix. This should be the lateral vaginal fornix. Behind the vagina is the ampulla of the rectum, and this is the levator ani muscle. This part of levator ani is forming this U-shaped sling of muscle fibers, which is called the puborectalis muscle, that causes angulation at the anorectal junction and is important for the continence of feces. Also, I can see here that there is a thick obturator internus muscle, and these vessels are the obturator vessels. They are going to leave the pelvis through the obturator foramen to supply the medial aspect of the thigh. In the bone, I can see the acetabulum, the head of the femur, and this will be the neck of the femur, continuing here more laterally as the greater trochanter of the femur. If you look closely at the acetabulum here, you can see that there is this structure here. This is the acetabular labrum. It's a cartilage that deepens the acetabulum. Posteriorly is the ischioanal fossa, filled with fat, And you can see the boundaries of this fossa. Laterally is the obturator internus muscle, and medially is the levator ani muscle. The fossa is covered by the gluteus maximus. Now here we are at the level of the lesser sciatic notch, and you can see that there are some vessels here leaving the gluteal region toward the perineum, and they are going to pass through the Alcock's canal or the pudendal canal. These are the internal pudendal vessels and the pudendal nerve. In this CT, I can see the ischioanal fossa here, obturator internus laterally. This should be levator ani, and the fossa is roofed by the gluteus maximus muscle. In this section, and which is located at a lower level, look at the front. Here is the pubic symphysis. On either side is the body of the pubis, and behind the pubis is the urinary bladder, but the urinary bladder here is becoming narrow. This is the neck of the urinary bladder, beginning of the urethra, and behind it is the vagina. More posteriorly is the ampulla of the rectum, and again I can still see the levator ani. Laterally is the obturator internus muscle. There is no continuity of bone here underneath it because of the formation now of the obturator foramen. And the obturator foramen is sandwiched between obturator internus on the inside and obturator externus on the outside. Going down, almost the same features. I can see the symphysis pubis anteriorly in the midline. Behind it is the urethra, and behind it is the vagina. Look at the close proximity of the urethra to the anterior wall of the vagina, and the posterior wall of the vagina is closely related to the ampulla of the rectum. In the ischioanal fossa, you can clearly see these vessels on the lateral wall. These are the internal pudendal vessels. They are located in a canal within the fascia of the obturator internus muscle. Posteriorly, I can see the gluteus maximus, and deep to it is the sciatic nerve here, and this is the other sciatic nerve here. It's the biggest nerve in the body. The bone here is the ischial tuberosity here and here. And in this CT section, you can see the pubic symphysis, the body of the pubis anteriorly. Here's the obturator foramen, obturator internus on the inside, obturator externus on the outside. This should be the ischial tuberosity, and this is the neck and the greater trochanter of the femur. In this section, at a lower level, I cannot see the pubic symphysis in the midline anteriorly, so we are at the level below the pubic symphysis, and we can see here the crura of the clitoris, crest from either side, and again I can see the urethra here. It continues more inferiorly to open below the level of the glans clitoris, and then here's the vagina, and more posteriorly is the anal canal. This continuous ridge of bone represents the ischiopubic ramus. In this section, at a lower level, we can see the vestibule of the vagina, and posteriorly is the anus. More anteriorly, this is the labium majus, and on either side here, this is the medial compartment of the thigh. This muscle is the gracilis muscle, and these are the adductor group of muscles. This concludes our study of the cross-sectional anatomy of the pelvis and perineum in a female subject. Thank you.